Okay, we are all here. Let's open up the March meeting of the Town of Newbury Human Resources Board. Present are
Diane Doyle.
Mark Bleckman,
John Ferrara.
Anthony Antico.
Patty Fisher.
thank you, and Lynn Peabody will not be able to join us today, but we have a quorum, so let's dig into the agenda. First item is to approve the minutes of the prior meeting. Diane, thank you for, as always, for getting these to us in advance. Has everyone had an opportunity to review the minutes?
I have.
Yes.
Is there a motion to approve?
So moved.
Is there a second?
Second.
Let's open it up to any discussion. Any edits, corrections, adds?
There was one edit under paragraph 6. It should read, Patty Fisher reported that over February vacation, the Newbury and Raleigh Police Departments conducted. So there should be an S, I think.
I've got an S here.
Okay, so maybe it's just.
Yeah, I think it got corrected.
It did get corrected, okay.
Conducted the joint training?
Yep.
Yeah, okay, thank you for that. Any other discussion?
No.
No.
Seeing none, all those in favor of accepting the minutes as written, say aye.
Wait, we need a motion.
Aye.
Aye.
Motion.
Made a motion.
Who did? Oh,
There's motioned and seconded already, was it not?
Yes.
Yeah.
who?
Oh.
Oh, motion and minutes for acceptance. You're right.
Who made the
I
motion?
moved.
Okay,
And a second.
I missed it.
That's quite all right.
Okay, sorry.
No problem.
Okay,
All set?
yep, all those in favor?
Aye.
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 Off to a little
Next.
rocky start.
Next item on the agenda, any employee issues. As always, we'll have Diane or Patty for any input there. No
None.
employee issues that you're aware of?
None brought to my attention.
Thank you very much. Personnel actions and job vacancies. I know last month, Diane, you talked about a number of positions that have been filled. Assistant town planner, assistant town accountant, assistant town clerk all filled. Chief Fisher talked about 2 promotions within PD, Jenkins and Smith. The only thing as of last month that remained open was the harbor master helper's position, seasonal,
Yes,
and that's still the case, or?
that is still the case. We're doing a background on one interested candidate right now.
Okay. How many harbor master helpers do you need?
So it depends. We've usually had 2 or 3 in the past, depending on what people's availability to work is.
And typically, do you have all the applications in by now, or is it typically
We've had the
close
same people for so long that I can't answer that question.
to expect the same this year?
I'm hoping that we'll have it covered, but yeah.
Okay, good.
You did hire one assistant harbor master.
We did hire an assistant harbor master, yes. And I can use him to help fill in the harbor master helper piece for a while until we make sure that that's steady.
Good, thank you. Anything else coming down the pipe in terms of new positions, Diane?
That I'm aware of, no. Things have settled down.
It's a good thing. Workplace discrimination issues, ethics issues, none that I'm aware of.
That I'm aware of.
Good, good. Safety issues, we'll turn to Chief Fisher in just a moment here to talk about something specific, but in general, anything related to town hall that, or any of the other facilities that we might need to reference in terms of safety issues?
No, I did have a question that was brought to my attention, so after this one on the agenda, I think I'll just wait till you speak to it and then we can, I have a question about COVID protocols.
Okay, perfect.
Okay, then we'll turn to Chief Fisher and talk about the latest from the state and anything else that's relevant to that.
Perfect. So on March 15th, I received this notification from the Governor Maura T. Healy, her office. It says, today the Healy-Driscoll administration announced that the state's COVID-19 public health emergency will end on May 11th, 2023. To align with the end of the federal public health emergency, the announcement this week, ahead of the 45-day notice required by state law, allows additional time for impacted organizations to prepare for the end of the public health emergency. Governor Healy will also file legislation that would extend key flexibilities provided by public health emergencies, particularly around staffing for healthcare industries and emergency medical EMS. The governor also announced that on May 11th, she plans to rescind Executive Order 595 that required all executive branches, state employees to have received their primary series of COVID-19 vaccines. She goes on to state that thanks to the hard work of our healthcare providers and communities, we've made important progress in the fight against COVID-19, said Governor Healy. We know that we have the tools to manage this virus, vaccines, masking, testing, getting treatments, and staying home when sick. And we've reached the point where we can update our guidance to reflect where we are now. I'd also like to acknowledge the leadership of the Governor Baker and his administration, who saved countless lives by putting these important measures in place in a time of immense crisis. Executive Order number 595 has been a successful tool for boosting vaccination rates and reducing the spread and severity of COVID-19 in Massachusetts. We're grateful to the state employees who did their part to keep themselves, their coworkers, and their communities safe, Lieutenant Governor Driscoll said. We encourage Massachusetts residents to continue taking important prevention measures to keep our community healthy, like getting boosted, masking, and staying home when you're feeling sick. We are fortunate that in Massachusetts, the wide availability of vaccines, testing, effective treatments, and PPE changes the course of the pandemic that brought the loss and hardship to so many. 3 years from the start of the pandemic, we are now in a very different place, said the Secretary of Health and Human Services, Kate Walsh. While we continue living with COVID-19, we can now incorporate the tools to manage this virus into our standing response and respiratory illness within our communities and healthcare systems. Governor Healy's legislation would continue flexibilities currently in place regarding staffing for our hospital dialysis centers. This would apply for 6 months to allow dialysis centers time to return to the pre-COVID-19 staffing levels, authorize certain non-medication administration programs, MAP certified staff to administer certain pre-packing medications in community settings. This would apply for 6 months to enable DPH to finalize reforms that streamline the MAP program training requirements, and allowing staff of ALS support level ambulance transports with a single EMT provider and a first responder driver rather than 2 certified EMTs. This would be a permanent change based on the positive experience of this staffing model over the last 3 years. Executive Order number 595 to help raise the percentage of fully vaccinated executive departments employees from around 76% to over 99%. Mandates for all staff in certain roles and settings will remain in place per CMS and EOHHS regulations. The end. Notification.
So as a practical matter or as a local matter, what, if anything, does that do to the town of Newbury and how we're running our protocols for facilities, staff, public? Does anything change?
I don't foreshadow any sort of change. I'm going to have a discussion with this with the COVID-19 team that was put in place, just to make sure I'm not seeing anything differently. But I don't really see a change. We've been kind of complying with the state as they increase and decrease throughout the pandemic to stay compliant. This is just the official notice stating that the pandemic is officially over.
From the state perspective.
From the state
But each
perspective.
municipality has options available to it. If you saw a spike, or if our COVID-19 response team saw a local spike, you would have the autonomy to make decisions here within Newbury.
That's correct.
Great.
So will you put out, around May 11th, will we have any sort of update for staff in terms of, like if someone tests positive for COVID, is there any requirement for them to stay out? Is there any, is there a protocol understanding that if someone's sick, but if someone doesn't display any symptoms and they test positive, are they still required?
We'll meet and, because I'll need to consult with the Board of Health with those types of specific questions.
Okay.
But we will put out something as it gets closer to that date, townwide.
Okay.
For the buildings, yeah.
I've also been asked whether that means we'll be taking down our plexiglass.
I don't see why you know, we would have to, again, I'll get you a definitive answer, but anything preventative that we can help to prevent against spreading of any germs,
Right.
I don't see as a mandate to take down anything like that.
Yeah, but if somebody has requested that if they take theirs down in a specific office, like, is it gonna be a uniform decision, or will there be some flexibility? Because I have had people ask me, you know, when can we take the plexiglass down? And I don't see it as an obstacle to do business. We've made it work all this time, and like you said, it only prevents, you know, general illness in terms of influenza or some of the stomach things that are going around. But I have been asked to ask whether if they want to, if they can take down the plexiglass.
What's the rationale for taking it down?
They just feel like it's intrusive, or they feel like it's non-friendly, especially if there's been an update to the protocol sort of ending.
Yeah.
So it's just, I'm bringing it up just as a point of discussion for you in your meetings.
Yeah, that's perfect, thank
That's
you very
been
much for
asked
bringing that
of
up.
me.
How does it all tailor in with the school rules? If a child or a teacher gets ill, how many days do they have to quarantine?
All of that will have to be discussed between the school, you know, with their protocols and ours, but
I mean, if anybody believes that this is the end of, you know,
Illness.
the dynamic of world-class illness, I mean, airlines have popped open, international travel is back to normal. The next one is not when, it's or if, it's when. And why not have your position pieces in place? And it would seem logical for department heads to say, live with it. It's not such a detriment to your business. And probably an awful lot of your town clientele and stakeholders appreciate it.
Yeah, just a point of discussion.
Yeah, just
Yeah.
piggybacking off of Diane's original question, it might not be a bad idea to come up with a short list of FAQs that both town employee population and the general public are likely thinking about, or will be thinking about when they hear about this change in statewide mandate or protocols. Because Diane's point, sure as heck, somebody's going to test positive in town hall or at the library or the DPW or in the PD, 3 weeks from now, or in mid-May, and what will be the town's protocol when that happens? Will somebody be required to be out for X number of days? So probably a good idea to come up with a short laundry list of things that might be on people's mind going forward. So.
Yeah, absolutely. And if anyone comes up with any other questions between now and the dissemination of the email, answering those and hopefully giving a little bit more additional information, just shoot me an email, let me know, and I'll add it to the list of things to find out when the committee convenes.
Yeah.
I mean, early on, John would send out updates to kind of status of where things stood, and it was always a good reminder. So, if nothing else, it might be, a good opportunity to, like Mark said, some definitive answers to some of the questions, but also just as a reminder to people, be diligent, be aware, so.
Yeah, and there are always going to be on-the-fly decisions that are made because of circumstances we don't anticipate, but something as basic as I'm an employee in a town facility, I've tested positive, what are the do's and don'ts?
Yeah, absolutely.
Yeah.
Okay, thank you.
Okay.
Just lost it. Anything else from a safety perspective?
No.
in this town hall? No? Other business? None that I'm aware of. I did just very briefly speak, I didn't speak with, but I'm sorry, I don't know what I was going to say. If anyone has, per Chief's suggestion, if anyone has suggestions of questions to add, I would recommend you send them only to the chief. Do not CC the rest of us so that we don't run into an open meeting violation, even though we're not discussing these issues. It's probably best if a quorum of this board is not CC'd on these. So everyone just sends stuff individually to the chief, and you know, she can collate them and get back to us for the next meeting perhaps, so,
Perfect.
okay, thank you.
Thank you.
I'm not aware of any other business, new business?
You said I had the opportunity to
Oh,
speak.
I spoke to Tracy briefly. She, you know, because of all that's happened with budget and prep for town meeting and the like, she assured me that she's very close on preliminary work she's done regarding the org chart, the oft-discussed org chart. And I think we're close. She was originally hoping that we could put it on the March meeting. I checked with her a week or so ago. She asked us to give her one more meeting, so I'm about as sure as I can be that it'll be placed back on the agenda for April. And
Her hope is to have a preliminary chart, or her hope is to have a discussion about where it stands.
I think the preliminary chart, I
so
think she
as
said
well.
that she'd been
Okay.
working with Matt,
Yep,
putting something together, and it was close,
okay.
but she still had other priorities.
And I know I had to submit mine to her as well, so that's why I believe
Okay.
it's
Great. Thank
preliminary
you.
as well.
I'm not aware of any other new business to address. John, Tony,
Another thing.
Chief, anything else? Hearing none, let's talk about the next meeting. April 24th, I would ask that someone in my absence run it. I'll be out of town.
You going to Latitude South?
What's that?
You're going to Latitude South?
Latitude South, yeah.
That's fine.
Is that date work for everyone?
The
Monday,
24th?
April the 24th?
That works for me.
Fine for me.
We'll make sure that Lynn's aware of it. I'll put it on the calendar just to be on the safe side and remind myself.
Of course, Latitude's below Saugus, south, so you're going even additionally further.
Okay. April 24th at 4 PM.
Okay.
Any other business?
No.
Seeing none, is there a motion to adjourn?
Motion.
Is there a second?
Second.
Any discussion?
None.
All in favor of adjournment, say aye.
Aye.
We are adjourned.
At 4:16.